Good afternoon, everyone. I'm Nirav Shah, the director of the Maine CDC, and I'm joined this afternoon by Commissioner Jean Wambrew from Maine's Department of Health and Human Services. Commissioner Wambrew and I are pleased to be with everyone this afternoon to talk about where things stand with respect to COVID-19 for today, Wednesday, January 19th, 2022. We begin today's set of updates on a sad note. The Maine CDC is reporting 30 additional COVID-related deaths today. These deaths were from residents across the state of Maine. 13 were women and 17 were men. They ranged in age from under 20 to over 80. 17 of the COVID-related deaths in today's death reports of 30 were identified through our ongoing vital records review process. Those deaths, those 17 deaths, occurred between November 15th of 2021 and December 29th of 2021. We'd like to take a moment to offer our deepest condolences to the friends, family members, and communities of all 30 individuals. Right now, across the state, Maine CDC has recorded 162,940 cases of COVID-19, representing an increase of 1,545 cases of COVID-19. I want to pause for a moment on the number of new cases and provide some context around that number. As we've talked before at these briefings, the value of daily case counts at this stage in the pandemic is quite limited, and that's for a few reasons. Chief among them is that the number of new daily cases is not and has not been a function of the number of new COVID positive results that Maine CDC receives. That's because in order for a positive result to become a, quote, case, someone has to review it, make sure it's not a duplicate of another result, and then enter that data into a US CDC website. That process takes us and every other state and large city time. We've talked about this before throughout the pandemic. But the current COVID wave has been so large that it has outstripped our ability to create new daily cases of COVID-19, that process that I just mentioned, every single day. This has happened throughout the pandemic from time to time. However, in light of the current tsunami of Omicron cases, this process of creating and converting a positive result into a case has been even harder. Over the last 7 days, the Maine CDC has received an average of 3,172 positive PCR and antigen test results every single day. 3,172. Compare that with December 30th of last year, not even 3 weeks ago, when the Maine CDC was receiving a combined total of 957 positive results every single day. So in under 3 weeks, the number of positive results coming in has more than tripled. This is a function of the Omicron variant. That massive increase in the number of positive results coming in every single day has resulted in 46,000 positive lab results that are awaiting review and processing. Now, it's important to note that the individuals to whom those positive lab results belong have received notifications, perhaps from their provider, almost certainly from the lab, and from the Maine CDC, that they tested positive and should be isolated. But this staggering number of cases that this staggering number of positive lab results that we've received just in the past few weeks means that the concept of a case count is a function of how many lab results our staff can process every single day, but not how many people caught COVID in the past day. Indeed, the case count was never that. the case count was always a look back in epidemiological time to the weeks leading up to the time when a person got infected with COVID, got tested for COVID, had that result reported to the Maine CDC, and turned into a case. That's the chief reason why focusing on case counts in this pandemic, at this point in the pandemic, is of less value than at the outset of the pandemic. But it's not the only reason to focus on other variables other than the case count. As we've talked about before, the popularity of home tests means that many individuals test positive without the Maine CDC being notified. That's okay. You being able to test yourself in your home on a rapid basis is what really matters. Of course, if you test positive rather, it's really important to stay home and isolate. Another reason to focus on other metrics than the case count is Omicron itself. Given that for many people it's milder, many individuals may not test at all. And the fact that many people with breakthrough COVID cases, particularly driven by Omicron, are asymptomatic means that they too may not test at all. But both categories of individuals can still spread, which means that they're not captured in our daily case counts, but can still be spreading COVID-19. All of this is a reminder that daily case counts are and always have been an underestimate of the true number of cases out there. This is also something we've talked about during different parts of the pandemic. So what's the bottom line? At this point in the pandemic, case counts are not the metric of the moment. So what metrics do matter? Give me a couple minutes. I'm going to come back to that question in just a second. Before I do, I want to provide some updates on testing, hospitalizations, and vaccines. Let's start with testing. Our 7-day PCR positivity now stands at 21.2%, in line with what other laboratories and hospitals across the state are themselves seeing. PCR testing volume now stands at 877 PCR tests that are being conducted for every 100,000 people in Maine. 1 week ago, that number was at 825 for every 100,000. So just over the past week, we've seen a 6% growth in PCR testing volume all across the state of Maine. Hospitalizations, something I mentioned a moment ago and we'll talk about in a bit in a minute. Hospitalizations in Maine now stand at 411 people who are hospitalized across the state with COVID-19. 2 weeks ago, one incubation period ago, that number stood at 382 people who were in the hospital across Maine with COVID-19. Right now, there are 102 people in a critical care unit bed with COVID-19, whereas 2 weeks ago, that number stood at 117. So we've seen a reduction in ICU usage just over the past 2 weeks. Similarly, with respect to ventilators, where right now there are 53 people on a ventilator in Maine, whereas 2 weeks ago, one incubation period ago, that number stood at 59. What does all that mean? Well, what it means is that we've seen a decrease in the relative severity of individuals who are hospitalized with COVID-19 in Maine. Although overall hospitalizations have gone up, that's been driven by non-ICU, non-ventilated patients. That category of patients has thankfully started to come down. Turning next to vaccines and vaccinations. Right now across the state, Maine is administering 4,646 doses of COVID-19 vaccine every single day over the past 7 days. This is actually down a bit. It's down a bit by about 3.5% over the past 2 weeks and about 18% just over the past week. However, Maine still stands strong among other states when it comes to vaccination rates. As of the latest US CDC data, 76.8% of the entire state is now fully vaccinated, and just under 50%, 49.4% of the entire state of those who are fully vaccinated are now boosted. Both of those metrics put Maine in the number 3 spot for fully vaccinated and boosted among all states in the country. Which takes me to my next update, and that is about the vaccination site at the Augusta Armory. That vaccination site at the Armory is coming up on its last day. As folks will remember, Maine CDC, Maine DHHS, the Maine Emergency Management Agency, and the Maine National Guard opened that site on December 7th in direct response to an urgent need for vaccinations, particularly boosters. Since that time, the team at the Armory has administered more than 10,000 doses of COVID-19 vaccine, a towering accomplishment. However, having met that demand, we've seen vaccination rates fall, as I mentioned a moment ago. As a result, the last vaccination clinic day at the Armory will be next Thursday, January 27th. But you still have time to pay the team there a visit. The Armory will be open tomorrow, Thursday, from noon until 7 p.m. And next Tuesday, January 25th, from 9 a.m. till 4 p.m. And then for its final vaccine clinic next Thursday, the 27th, from noon to 7 p.m. We're also, of course, offering COVID-19 testing at the Armory, and that will continue through mid-February. An appointment for COVID-19 testing at the Armory is required. Please check our website or our social media feeds for information on how to sign up. And finally, to round out today's soliloquy, I want to talk a bit today about wastewater testing. A few moments ago, I said that daily case rates are not the principal metric of the pandemic at this point. So what metrics do matter? What helps us? What helps you understand where things stand on a day-to-day or week-to-week basis in your community, in your county, and in our state? Well, one metric that I've talked a lot about is hospitalizations. Hospitalization rates give us a good sense, particularly of the severity level of the pandemic, especially when we focus on things like ICU and ventilator usage. But hospitalization data, like all data, have limitations that we need to be aware of. For example, many people, especially if they're really sick, are transferred to larger hospitals in another city. So we may still have a good statewide picture of the severity of the pandemic, but a less detailed local one, because where you're hospitalized may not be where you live. In addition to not being geographically specific, hospitalization numbers can lag infections by 10 or more days. And that's why I want to today focus on another tool that we are expanding the use of here in Maine, and that is wastewater testing. I want to talk about what it is, how we plan to use it more, and what it means for you. So what is it? Well, in wastewater testing, municipal water systems take a small amount of the water that flows back to them and send it to a laboratory for COVID-19 testing. That allows us to see if there's COVID in the water, and if so, how much COVID there is. Doing this on a frequent basis gives us a sense of how the amount of COVID changes week by week, community by community. It's a helpful tool to monitor and track the course of the virus at a community level. Wastewater testing can provide an early indicator of the presence of and the trends of COVID-19 cases across a community. So how do we plan to use it even more than we are right now? Well, Maine CDC has been working with the US CDC, the Maine Department of Environmental Protection, as well as wastewater system operators across the state to expand the scope of our wastewater testing efforts to roughly 20 different wastewater systems across the state, from Guilford to Bethel to Bath. Some sites are coming online in the next week or two, and other sites are coming online thereafter. How will this expansion help us understand what's going on in the pandemic? Well, first, as I mentioned a moment ago, the metrics that we have used to date are showing their limits. For example, things like daily case counts. That's where wastewater testing comes in. It gives us a picture of how much COVID is in a community at any particular point. We've learned from the wastewater testing that's been done so far that it can be a leading indicator of the presence of COVID-19 in a community. More than that, the changes in COVID-19 levels in the wastewater have been shown to track the changes in COVID-19 rates in the community. In fact, the increase in wastewater COVID-19 rates precede increases in illnesses at the community level by several days. Wastewater testing also provides a more geographically specific look than does hospitalization data, for the reason that I mentioned a moment ago, because where people are hospitalized may not be where they live. It's important to note that wastewater testing is not diagnostic testing. It doesn't occur at the individual household level or even at the neighborhood level. It occurs at the community level. Now, the big question on the table is, what do we do with these data? Well, wastewater testing provides us a pooled community sample, and it provides us data for testing at the community level where timely COVID-19 clinical testing may be a little bit less available. It gives us an early look on the emergence or the reemergence of COVID-19 infections at a community prior to seeing those numbers pop up in case reports. And it provides us a more complete picture of COVID-19 regardless of who chooses to be tested in a community. If we see spikes, we can pivot, but we can't pivot unless we have the data. So what does pivoting look like? Well, here's one example. If we were to see a spike of COVID-19 at the community level, we could, as one example, alert local hospitals for a potential increase in hospitalizations, or to alert clinicians in the area that a patient who comes in with COVID-19 symptoms may be more likely to have COVID than, say, another respiratory infection. The data that we will be generating from this wastewater testing will be publicly available for everyone to see, use, and analyze. The bottom line is this. As I said last week, the virus is evolving and has evolved. And as a result, so must our tools to track and monitor it. Expansion of wastewater testing in Maine is a solid step in that direction. It was a lot today. My apologies for going on. We've got a fair number of questions. We've got 13 colleagues and 13 of our colleagues from the media, and Commissioner Lambrou and I are happy to talk about everything else that's going on. So the first question in the media from our media colleagues today goes to Patty White.
Thanks very much, Dr. Shah and Commissioner Lambrou. Dr. Shah, in terms of the wastewater testing, you said you're going to post it to your dashboard. Can you tell us a little bit more about how often you're going to post the data, and then is it going to indicate if the level is, low, moderate, or high, or how are we going to be able to interpret that?
So Patty, on the former, there are going to be more details coming once we finalize the list of which communities will be participating. I mentioned a few of those communities like Bethel, Guilford, and Bath. There are others that are going to be coming online as well. Some of the data will likely be posted on the US CDC's website because they're aggregating a lot of this to have one unified look at it. So we're looking at how that will be, what that will look like. Many more details to come, Patty. Today, I really wanted to just talk about wastewater testing as a concept, what it does and what we do with it. Many of the tactical granular details will be coming out soon. Similarly, with respect to categorizing it. Right now, what the approach that we and other jurisdictions have been taking and thinking about is less about categorizing it low, medium, high, green, yellow, red, and more just about providing the data in graphical form. That's really where we are right now. But again, many more details to come on that, Patty.
Okay, thanks. And do you have a sense how many other states are ramping up wastewater testing like this?
Not a specific sense, Patty. What I can tell you is that we in Maine have been part of a broader set of discussions that other states have been having with the US CDC. We're not alone in moving more toward this direction, but I don't have a specific number of states that are expanding at the same rate that we are. I'm proud of where we stand, though. Based on our conversations with the US CDC, Maine we're being aggressive in our approach to expanding the use of wastewater testing because, as I mentioned a moment ago, it fills a gap. We think that it's a better predictor and metric than our, for example, daily case counts. And it helps us provide a more holistic view of where we stand in the pandemic.
Okay, thank you.
Thanks, Patty. Let me go to Patrick Whittle next.
Thank you very much. Wanted to make sure I have my mind around a couple of things regarding the new metrics. So, you said moments ago that the positive PCR and antigen tests are not the metric of the moment. Those aren't really giving us a holistic view of what the status of the spread of COVID-19 is in the state right now, the way that wastewater testing possibly could.
So, Patrick, when I described what's not the metric of the moment, I was really specifically talking about the daily case counts. PCR and antigen positivity rates are still something we track. I report out on them. They have utility, less than they did before for different reasons, based on who's getting tested. And nowadays, if you're symptomatic, you're more likely to get tested, so on and so forth. I think the value of PCR positivity rates is not what it was before, but it's not in the same low value category as our daily case counts.
The wastewater test can serve as sort of a better predictor of future cases. Is that a fair way of putting it?
That is correct. They are a leading indicator. We have seen them be a leading indicator, and they can be a leading indicator, giving public health and healthcare folks several days notice before potential increases in cases coming into the hospital doors, for example.
Right. So we've seen in other cities and states, especially very, very populated cities like New York City, for example, that we seem to be at the top of a sort of a crest of cases now, possibly coming down. Is Maine sort of just lagging behind that curve because Omicron arrived here later? Is that potentially, are we sort of going up this escalator that's about to start going down like it is in places like New York?
Hard to say, Patrick. I'm encouraged by some of those data from other places in the Northeast. Some of those are case data. Some of it is wastewater testing data, as it turns out. It's really too early to tell. I think it's likely that we'll see something to that effect here. But Patrick, to the point that you raised, I want to distinguish between the number of positive results that are coming in every day, which I hope to see a decline in, and the number of new cases, which will continue to be a function of what our team can process.
Right. Something that I think is one final thing I think is worth touching on today. Several weeks ago or a few weeks ago, the CDC changed the quarantine guidelines from 10 days to 5. After 5 days, lots of people, if they have access to a home test, will test themselves and they'll find out, hey, this still says that I'm positive right now. Do you have any? What should people do if 5 days go by and they haven't had a fever in 24 hours, their symptoms are gone now and things are more or less back to normal, but they take the second test out of the box and they still come back with that dreaded second red line?
Yeah, I've definitely heard of folks or seen on social media folks for whom that has been the experience. What the US CDC says or recommends in that situation is that if you opt to take that second test in the box on day 5 and it's positive, even if you don't have any symptoms, the smart thing to do is to continue isolating until day 10. If that test is positive, it suggests that there's still a risk that you could spread COVID to others. That's why the smart thing to do, the right thing to do, is to keep your isolation period out for another 5 days.
And does that 5 days start with the onset of symptoms?
Yeah. So according to the CDC, there are 2 ways to start the clock when you're looking at isolating for 5 days or 10 days. One way is the day that your symptoms started, or if you don't have any symptoms, that you took a test because you were going to go visit your grandmother. It's the day on which you took it's the day on which you took the test and it was positive. So there are 2 different times you can start the clock. One is if you have symptoms. The other is if you don't have symptoms, the day on which you got a positive test result.
So that either that onset of symptoms or that day of the positive test, that's essentially your day 0.
That's correct. That is exactly right.
Got it. Thank you very much for clarifying that.
Yep. Thanks, Patrick. Let me go to Rebecca at the Ellsworth American next.
Hi, Dr. Shah. Thanks for your time. So will this wastewater testing, can you see it expanding to more communities as time goes on?
Rebecca, I don't want to promise that. Right now, we're working on the first phase, which is roughly speaking 20 communities. And we worked with epidemiologists, Maine DEP, Department of Environmental Protection, and the US CDC to select a broad swath of communities, some urban, some rural, some with a lot of testing, some with less testing, some with higher vaccination rates, some with lower, et cetera. We cast a very broad net. We think that gives us a broad and thorough geographic look at the state. I don't want to say that we won't expand, but right now our focus is on this first set.
Thank you. And just one question, switching to masking, with there being some updated guidelines, do you think that guidance that, regarding switching to surgical or KN95 or N95 masks, will that eventually apply to schools?
Yeah, Commissioner Lambrou and I have talked about this at length. Commissioner, I'm happy to turn it over to you or take this one, either one.
We think that the US CDC guidance is fairly clear when you read it closely. We urge all of our school leadership to make sure that they do look at it. It does differentiate when somebody should wear a respirator, that is an N95 or a KN95, not the surgical type. Those are reserved for our healthcare officials as well as other sorts of PPE. So we do urge people to look closely at that guidance if they're employers, including schools. And we are grateful that we are at a point where we don't have that kind of supply chain crunch that we did at the beginning of the pandemic. Most forms of PPE are widely available commercially, and you can access it. So we do think both the guidance does speak for itself, and we're hopeful that people can access it in many different ways at an affordable price.
Okay, thank you.
Thanks, Rebecca. Eric Russell, over to you.
Good afternoon, Dr. Shah, Commissioner Lambrou. Going back a little bit on the case counts, the raw data that you report every day from the test results, so the total number of tests that come in and the total number of positive results, even though that contains some duplications and stuff like that, is that a decent metric to use for showing like a trend line? Again, I think, daily case counts are great, but I think, we've used them more to show trends upward or downwards or leveling off rather than, one day this, one day that. I think the importance has been the trends, right? Could you still show the trends using that raw data, or is that faulty?
Eric, I hear where you're going. Let me first start by just noting for everybody that the data that Eric is referring to is on our website. We do put out every single day the raw number of positives, unduplicated, that are electronically reported to us for PCR and antigen tests. So those data are out there. And Eric, I don't disagree. As you say, for trend-making purposes, it's useful to see those changes. I myself look at those data, the raw underlying positive numbers. I myself look at those to look for trends and do analysis on them. So I think there's more value. But let me start by saying this. There is definitely more value from those raw underlying positive numbers every day data than there are from case counts. The asterisk on that statement, though, Eric, is that what I noted, not to repeat what I said a moment ago, but who is getting tested now and where they are getting tested is fundamentally different from a year and a half ago. Many, many more at-home tests, which skews those data, or it undercounts those data, doesn't skew them. It also, with some folks who are asymptomatic, not getting tested because they have mild cases, it's just a different subset of who's getting tested. Your point is right. For trend purposes, it tells us something, but it doesn't tell us where we stand with respect to things like disease burden. That's why we think wastewater testing is a better metric for that.
Okay. And I want to hone in a little bit on hospitalizations and what you talked about with, overall trends going up, but, level of severe cases coming down. Is there at all a risk of messaging, people hearing, oh, it's a milder form of the virus. If you get it, you're not going to be hospitalized. And if you do, you won't be in critical care on a ventilator. And I know you've talked a little bit about this, and Commissioner Lambrou as well, about, the multiplier effect. If everybody out in Maine has COVID, it seems like, right? Like the numbers are going to go up astronomically. So are you worried at all about the messaging of this being a milder form of the virus? And what do you do to combat that?
A little bit, Eric. First and foremost, we have to be straight with people. Thankfully, the data out of some recently published or pre-printed surveys and studies from Case Western, another from Houston Methodist, and a third from Kaiser in California, just in the last 7 or 8 days, have all pointed in largely the same direction, which is thankfully that Omicron is milder than Delta. But boy, that's not saying a lot. And Delta was pretty rough. Even something that's milder than Delta is still a significant illness. And as we've seen just from recent deaths, it has definitely been taking a toll. So I am a bit worried, but I think it's also equally important to be straight with folks. At the same time, Eric, what we've heard me say is to underscore the point that you made, even something that's milder on an individual level can still have significant impact at a population level. And if you're the one in the hospital on a ventilator, it's certainly not mild for you. We haven't let up on our messaging and our recommendations for folks to get vaccinated and boosted. And so for me, that is the appropriate counterweight to the concern that you raise, to the extent that there are folks who are listening right now who are saying, I wasn't sure whether to get vaccinated. And now I hear that Omicron is milder, don't go to town with that. Don't take that to heart. There's still 102 people in the ICU in Maine, most of whom will have Omicron, 53 people on a ventilator, most of whom will have Omicron. It is still significant.
And real quick, Dr. Fauci said, I think yesterday, maybe the day before, that, unless another variant comes along that proves really vaccine resistant, that, Omicron could potentially lead to a degree of herd immunity that everybody's been talking about for the better part of 2 years now. Do you agree with that?
Well, first, important to spotlight two operative words, even in the stem of your question: could and potentially. Hard to know. There were those who said that about Delta, and then the subject. If there's not another variant, we don't know if that's the case either. All that said, it may be the case that Omicron, because it's so contagious, that we all have a date with it. I'm hoping, and our goal right now is to make sure that not everyone's date with Omicron happens on the same day. We want to make sure that the hospital system doesn't get overwhelmed. But if that were the case, then yeah, we may come out on the other side of Omicron with a higher degree of population level immunity. But Eric, let's not forget for a second the cost that we paid to get there, the number of people who died as a result. And I know you're not suggesting that, but that is why we are hesitant to embrace that approach.
Thanks so much.
Mm-hmm. Thanks, Eric. Let me go to Megan at WMTW next.
Thanks for taking my question. It's a little bit kind of what Eric was talking about too. At what point do we transition to an endemic? What's the metric there? What are we looking for? I know you probably have your crystal ball somewhere underneath the desk or whatever, but I know that that's just what a lot of people are talking about.
Megan and Commissioner, please weigh in on this as well, because we Commissioner and I talk about this a lot. This question strikes me in the same manner that when economic times are rough, it's commonplace to ask economists, are we in a recession yet? Are we in a depression yet? It's one of those things where in a pandemic, the only thing that we know for sure is what happened yesterday. So when we transition to an endemic state, is every epidemiologist has a different way of understanding and looking at what that means. One epidemiologist who I respect quite a bit frames endemic as asking the question, if the current state that we are in today were to continue for the foreseeable long-term future, would that be sustainable? And if the answer to that is yes, then it's reasonable to think you're in an endemic state. If the answer to that is no, then you're not there yet. I think all of us would agree that we are not there yet when it comes to officially thinking about ourselves as an endemic state. But Megan, that assumes it's a dichotomy. That assumes it's a switch on the wall that we turn on and off. It's not. It's a gradual process of understanding what matters right now and what is less useful. We've talked last week about measures that were showing less utility. Today, I talked about another one, a metric that you yourself had raised a couple of weeks ago, the daily case count. All of these things are steps in that direction toward that sort of endemic state.
Okay, and just really quickly, I've just sort of colloquially, I've heard that people are taking at-home rapid tests, getting negative results even after a couple of times, and then getting a PCR test and getting a positive result. Should this undermine our faith in the accuracy of an at-home rapid test?
No, I don't think it should. There are a couple of things going on there. Folks who are taking at-home tests, those results can change a little bit, because if you are right on the cusp of having enough virus in your system to be infectious, it could go up one day and go down a little bit the next day. So no, I think if you have sufficient reason to take a test because your friend called you and said that they had COVID and you just had lunch, or you're not feeling well, it's worthwhile to take more than one. And if you get a positive, make sure you're staying home. If you get two negatives, but you're still feeling crummy, you should still be staying home. The other thing we're learning, and I think this is something that Mal asked a couple weeks ago, we're learning more and more about where you collect the specimen from. And there's more data now than there was even a few weeks ago, suggesting that because of some differences with Omicron and where it lives in the body, rather than collecting the specimen from your nose, getting it from the back of your throat may improve the accuracy of the at-home antigen test.
Thank you.
Mm-hmm. Speaking of Mal, over to you.
Thanks, Dr. Shah. I know that you don't like to get political, but a number of communities have taken up local mask mandates. When do you think we might see signs that these types of efforts are making a difference?
Hard to say. I mean, we encourage that for sure. Masking remains a useful part of the pandemic. But Commissioner, I'll turn this one over to you.
We continue to believe that truly the best way that people can protect themselves against COVID-19 is vaccination. We've done everything we can to educate people, remove barriers, and to encourage workplaces, for example, that do require their workers to get vaccinated to do so. We also do encourage people to wear masks in public indoor settings. There are some municipalities that have taken that to a different level. We appreciate that they have that choice and that ability to do so. We know a bunch of schools have done so as well. So we do support these efforts. We have no plans at this time to do any sort of statewide requirements. All that said, just going back to the beginning and these questions about Omicron and whether or not we're endemic, we still know that many people are in the hospital. Most of the people in the hospital with COVID-19 are unvaccinated, and it remains our focus on how we finally begin to move beyond COVID-19.
I know that, Commissioner, you just even yourself laid out some of the best practices that we've known from day one: wearing a mask, staying home if you're sick, and now getting vaccinated and even boosted. We already know these best practices at this point. What else needs to change for us to really effectively beat back this virus?
So this is where we're comparing to a counterfactual that we don't know. I mean, I do believe, looking at what's happened in different states, that the situation with COVID-19 could be much worse if we didn't have the high level of vaccination that we have in Maine. I think that our transmission, our ability to keep our schools open, our hospitals open, have been based on what we've been doing so far. We continue to try to learn about Omicron, figure out what is next in these strategies. This wastewater testing plan that we're working on will help us more quickly pivot. So that is the next thing that we are working on here. But again, I will just go back to the fact that if the goal is to keep our capacity in our hospitals, our schools, and our businesses open, we continue to need to improve our vaccination in Maine.
I do just have one last question for either you, Commissioner, or Dr. Shah. In the opening monologue, you mentioned that that there was death of somebody under the age of 20. What do you make of that?
Well, it's concerning, Mal. And as you know, I can't provide any comments or specifics on any particular case or death, but it's concerning. And I think, Mal, it's a reminder to folks who may be out there saying, well, hey, you know, I'm a younger person. I'm generally healthy. COVID can't bother me. It can't get to me. It can't land me in the hospital. And it can't lead to me losing my life. That's not the case. In Maine, as well as across the country, we've seen younger individuals being in the ICU, being on ventilators, and sadly dying. It doesn't have to be that way, though. The commissioner noted vaccines all but eliminate your likelihood, especially if you're boosted, of ending up on a ventilator or dying because of COVID-19. So, Mal, it's very sad, but it's also a grim reminder that COVID can stalk anybody.
Thank you.
Caitlin, over at the BDN, over to you.
Hey, good afternoon, Commissioner, Director Shah. Two questions, one from me, one from my colleague. Walgreens said today that 44% of COVID-19 cases in Maine are of the Delta variant, which is the highest of any state in the U.S., based on PCR tests conducted from across the state, and that was of December 30th. Do you feel that the prevalence of Delta is as significant as those numbers show? And if so, why does Maine appear to be lagging the rest of the nation in having Omicron becoming the dominant strain?
Caitlin, I didn't hear all of what you noted, but did you indicate that those were from samples that Walgreens took 21 days ago?
Yes, that's what this question was.
Yeah, I mean, the Omicron spreads at such a rate where it is possible that 3 weeks ago we were in the 40% range, but today every model and every subset of data that we've looked at in the state has us at least at 80%, if not higher. The genomic sequencing that Maine CDC does in partnership with JAX that we put up last week had us at 79, we'll call it 80%. We've received point estimate laboratory results from different labs across the state, some of which have shown us to be in the 85, even 95% range. It's just given how quickly Omicron spreads, those are not inconsistent statements. We may have been in the 40s back a couple weeks ago, but that would have been when we were in the exponential growth part of the S curve, and we're now on the top end of that. Maine followed largely the same path in the expansion of Omicron that the rest of New England did. Maybe a few days, quote, behind in epidemiological time. And that's all largely based on when the models are based mathematically on when the first case was detected.
Thank you. And my second question, that I put this out certainly to both of you, a study from the University of Maine and UVM found that public health problems like, weight gain, medication stopping, stress-related illness, and substance misuse increased during the pandemic. Nothing too surprising, but all of those things seem to happen more so among people who were food insecure, which was also something they saw go up. What is the long-term effect of these issues continuing into the future? Are we at risk of a second public health crisis cropping up when the virus goes endemic or, stops being as much of a public health threat?
I'll begin by saying thank you for that question. We have, from the beginning of the pandemic, been very concerned about not just this direct effect of the virus on individuals who catch it, but these secondary effects on people for whom isolation may cause stress and delayed or deferred healthcare, that there may be other related problems like decreased exercise, which leads to increased health problems. So we have been tracking those metrics from the beginning and intervening when possible. Our strengthenme.com program is about providing people with specific assistance during the pandemic for the stress and anxiety associated with COVID-19. Our team has been working aggressively on what has been an incredibly sad increase in substance use disorders in Maine and overdose deaths. We've launched an options program that is putting teams out in all counties to help try to prevent people who have substance use disorders from overdosing. And we continue to look at all of our different indicators to see what, if anything, do we need to be addressing beyond this inner circle of COVID-19 to protect the public health. That work began day one. That work continued during the height of the pandemic. It continues to this date, and it certainly is on our horizon as well.
Yeah.
Thank you. Thanks, Caitlin. I'm going to go to Brian Sullivan next.
Thanks, Dr. Shah. I was wondering if you could talk a little bit about booster shots. I'm going to take a couple of viewer questions here and try to mash them together. And just what have you learned? You've been giving booster shots out to a pretty wide range of age groups for a couple months now. And what does the future of booster shots look like? And this one viewer did ask if there's too much of boosting that can happen because it lowers certain levels in your blood that would diminish the effect of the booster if we were to need a fourth or potentially more down the line.
Sure. Thanks, Brian. I'm going to take those in largely reverse order. First, by dispelling the myth or the concern that the viewer raised. There have been scores, millions of booster shots that have been administered across the country, now across the globe. And the concern that the viewer raised that there may be an adverse effect on our immune system from getting the booster shot, rendering it less able to fight if we need it there. That hasn't been the case. In fact, it's been the exact opposite. In recent weeks, 2 large studies have been published in the 2 most prestigious medical journals in the world, the New England Journal and the Journal of the American Medical Association, demonstrating that boosters lower the risk of death on top of just your first 2 doses by 90%. They also lower the likelihood of other severe complications by significant amounts. Brian, the bottom line of all of that is that the more we learn about the COVID vaccines, the more that we begin to see that they are really a 3-dose series of the mRNA vaccine and a 2-dose series for the J&J vaccine. It's less about getting your first 2 shots in your booster and really more about just getting all 3 shots. We've learned a lot about boosters here in Maine. Chief among them is that the demand for boosters is really strong. As I mentioned a moment ago, Maine is in the number 3 spot in the country for those who are fully vaccinated who have gotten their booster. And we're not far off the number 2 and even the number 1 spot. So I'd like us to regain some of that ground and get as many people in Maine boosted as possible.
Okay, thank you. And just keep on looking down the road. You mentioned many briefings ago, I asked you about the next group of young children who might be eligible for a vaccine. Can you give us the latest you've heard from studies that are being done about what that might look like?
Yep. Well, so you're referring to those who are 6 months of age up until the age of 5.
Yeah, kids that aren't eligible right now. Right.
Yep. As you may recall, Brian, there was some additional data that the FDA asked Pfizer to go back and accumulate for their vaccine, particularly for one part of that age group. The company is in the process of doing that. I have not heard an updated timeline from, say, the FDA or the US CDC about when that vaccine will be able to be rolled out. I'm not sure, Brian. I know that they're planning for it, and they've started working with different manufacturers, distributors to think through how the vaccine might be rolled out. But I have not heard when that might start to happen yet.
Okay. And just real quick, I think a couple of briefings ago, last time I was here, you made the analogy. You didn't know if we were going to have a wave or an icicle or an ice pick of cases. What do you think right now if you had 3,000 cases a day is what it could be? What's the thinking there?
So, what I can say, Brian, is that in other countries and states, that are, quote, ahead of us in epidemiological time, that have had a couple of days or weeks more experience, as it were, with Omicron, what they've observed is more of an icicle, a rapid increase followed by a fall. I was just actually on the phone last night with my counterpart from Washington, D.C., going over their data there, where it looks very much like an icicle. But here's the thing I want to just note. In a lot of those jurisdictions, there is a rapid increase and then a rapid fall, but it doesn't fall to the pre-Omicron level. Countries like South Africa, the UK, do experience a fall, but to a point that was still higher than where they started. That's the concern right now. If we do experience such an icicle formation, where do we land?
Okay, thank you.
Thanks, Brian. Emily Bader, over to you next.
Hi, good afternoon, Dr. Shah. I'm wondering, my first question, is there any additional, so people who are fully vaccinated and boosted, given that Omicron, there's the greater likelihood that you may have a breakthrough case, should people who are fully vaccinated and boosted and, still masking, but going about their business, maybe going into work, should they be testing more just to be sure that they aren't somehow carrying a case but are asymptomatic?
So Emily, just underscore, yes, someone who's fully vaccinated and boosted, you built this into your question, but I wanted to tease it out, should be masking, right? A surgical mask, a KN95, some combination thereof of both, but upgrading your mask away from a bandana or a neck gaiter, now is the time to do that, even if you are fully vaccinated and boosted. Now, in terms of testing, I think where we are with respect to testing in that category is where we've been recently, which is if you're fully vaccinated and boosting and assiduous about wearing a mask, all great things. When should you be tested? Well, certain employers have periodic testing, particularly if you work in healthcare. The other situation that I think testing is a good idea is before or after, or particularly before you're going to be in contact with someone who may have additional vulnerabilities to COVID-19. Whether it's your grandmother, a friend who's recently recovering from a serious illness, anyone for whom, or for example, a child who is, to Brian's question, not old enough to be vaccinated. If you're going to be coming into contact with those folks, that is a great opportunity to make sure you're testing beforehand. In addition, anything that you might be doing where yourself, you may be at a higher risk. If you're attending an indoor type of event where you're going to be coming into contact, almost certainly, with someone who's got the virus, testing yourself a day or 2 or 3 days after that is a good way just to make sure you are not, for example, going back into the workplace and inadvertently carrying Omicron with you.
So with Delta, I know there was a concern that even fully vaccinated people could transmit the disease at the same or a similar rate to people who are unvaccinated. Do we have any data on Omicron and how that compares?
We do. Individuals who are fully vaccinated and boosted can still harbor the Omicron variant and still transmit it to others. However, based on household studies, the best of which that I've seen and that has been presented to me came from a group in Denmark that looked at Omicron transmission within the household, particularly among fully vaccinated and boosted folks. It can happen. It's less likely, of course, among those who are fully vaccinated and boosted, but it can happen, owing in part to Omicron's ability to evade the immune system a little bit. But what's really important, particularly from that Danish study, is that even those who had Omicron while fully boosted or gave it to somebody else, thankfully, because they were fully boosted, generally experience very mild cases.
Okay, and I have one last question. I think this is for Commissioner Lambrou. So earlier this month, the Mills administration announced the purchase of 250,000 rapid tests that were going to be distributed across the state this month and next. Do you know what the status of that is?
Yeah, so we are very excited that we have started to see the arrival of the 250,000 Binax Now rapid antigen tests to be distributed to hospitals and the Walgreens pharmacy for their administration in schools. We got about 50,000 last week. We got a whole bunch of pallets today. I don't know how many arrived today, and we expect them to be arriving weekly going forward.
Great, thank you.
Thank you. Thank you. Amy, I'm going to turn it over to you. We've got 4 more. That's in part because of my longer diatribe, but Amy Brown, let me go over to you.
Okay. I have a couple of questions from listeners. One asks or says, we've heard that the virus travels in tiny water droplets we exhale. So what happens to those droplets when they dry up in an enclosed space? Does the virus remain viable, and for how long?
So you're right. The virus does travel through water droplets or aerosols, which are even smaller. But when they land on a desk or on a surface, they do dry out, and that renders the virus ineffective at causing any further transmission. That's why we don't recommend you wipe down your groceries or anything like that.
Okay. Another one that I think will be pretty quick is another listener has concerns that the free test kits may be exposed to serious temperature fluctuations, including below freezing here or hot temperatures in other parts of the country. Or sitting in mailboxes for a while. Are they temperature sensitive? How's that? We heard so much early on about the vaccines and the temperature sensitivity there. They're wondering if there's any concerns with the test kits.
Yep, there is a bit of temperature sensitivity. Like all things, there's a range in which they are most optimum to work in. If you do get one of those test kits in the mail and it's been really cold outside, you do want to give that test kit time to come up to room temperature before you use it, just to make sure all of the reagents or chemicals in the kit have had time to make sure that they're fully active.
Okay. And the final one, I think, is just sort of a yes or no question. Just to be clear, it's inaccurate to be saying moving forward that, and it probably has been from the past for a while, that the number of new cases today is X. If we want to be accurate, we should instead be saying that the number of new cases that the CDC has processed in the last 24 hours is X, but they do have a large backlog, and home tests generally don't get reported to the CDC. So the actual number of daily new cases is much higher.
Yes.
Okay.
And I love yes or no questions, Amy. However, but a better approach is to, frankly, move away from the notion of the daily case count as being what tells us what's going on in the pandemic. But that's a topic for another conversation.
Great. Thanks.
Yep. Thank you. Chris Costa, over to you.
Hi, Dr. Shah, Commissioner Lambrou. I'll try to keep this as quick as I can for you. The first one is hopefully a yes or no question. Now that the Armory is going to stop the vaccinations by, I think you said late January, will you guys fill those days that were normally used for vaccination to now be used for testing?
Thanks, Chris. You're right. January 27th is the last vaccine day at the Armory. We haven't made a final decision on that. We've got to balance the need to make sure we're doing more testing with other demands on the teams that are at the Armory. So no final decision, or let me say it differently, Chris. There's no current plan to do that.
Okay. And then another hopefully quick one for you. I know the term fully vaccinated is determined by the US CDC. You were speaking a minute ago about how really it's turning into people needing the 2 doses of an mRNA and a booster in order for it to be most effective. Do you anticipate, speaking with your colleagues, do you anticipate that the term will change at the federal level?
I know that there's discussions about that. I anticipate at some point, as with all vaccines, there will be a redefinition of what it means to be fully vaccinated. I just don't know when that might be. Chris, I'm loath to introduce new terms into the COVID dialogue, but the term that the US CDC has started to use, that I've started to use, is there's fully vaccinated, which is nowadays almost a regulatory term. But the thing I want to talk about is up to date. Are you up to date on your vaccines? Are you fully protected and up to date, which entails having your first 2 shots plus your booster?
Okay. One more that I hope will be quick, and then one that may need a little bit more explanation. And this one is, I think, probably more for Commissioner Lambrou, if you don't mind. Commissioner, I was talking with Jackie a couple of weeks ago about guidelines for childcare facilities. We know those kids under the age of 5 cannot get the vaccine right now. Many of them under the age of 2 obviously cannot wear a mask. She had been telling me that the US CDC is working on new guidelines for those child care settings. So my question to you is, do you know when we should expect those guidelines? And part 2, do you expect them to contain substantial changes to what we see now?
So we have been hearing that US CDC will be providing childcare specific guidance. We have not seen it. We have no anticipation of when it will be released. And then to your second part of your question, not clear what the guidance will look like. because you identified the two challenges. Many of those children are ineligible for vaccination, and a subset of them really do struggle with mask wearing. So at this point, the previous US CDC guidance is what we recommend for Maine child care providers.
Got it. We get a lot of questions from people about the free test that are available from the federal government. Obviously, Medicare is a very different situation. We have a lot of viewers who have Medicare who are asking about it. In the HHS document, it says that people can go get those free tests from a community health center or a Medicare certified health clinic. Can you guys just give me a very quick example of what that might be?
Sure. So there are some clinics that are providing different types of services like diabetes, but the federally qualified health centers in Maine are a great place to go to check out to see if they have access to over-the-counter tests or other types of testing options. People should call and find out before they go. And as a reminder, the president did announce that at www.covidtests.gov, you can very quickly and easily sign up for 4 home tests to be delivered to your home for free. The orders usually take 7 to 12 days. So if you take that option, stock up on them now in case you need them later.
Okay. And last question, I believe this is for Dr. Shah. This is a viewer question, Dr. Shah. We've heard a lot about the benefits of getting vaccinated, even if you already have natural immunity, meaning you've caught COVID and recovered. We know that it is preferable for somebody to still get the vaccine. This viewer is asking, how does getting a booster play a role in this? Is getting a booster necessary if you have natural immunity and you've completed a course of vaccines?
Yes. The quick answer there, Chris, is yes. Getting a booster, even if you previously had COVID and you got your first 2 shots of, say, Pfizer, even on top of that, getting a booster is important, particularly in the face of Omicron, given how we know it can actually evade the immune system. So getting that booster, completing that series, being up to date is really the best protection on top of having had COVID previously.
Thank you both for your time and patience.
Yep. Thanks, Chris. Corey, let me go over to you from WAGM.
Thank you, Dr. Shah and Commissioner Lambrou. My question is about the updated CDC guidance with regards to masks. My first question is why is this recommendation strongly recommending N95, KN95 masks, happening now as opposed to, in the beginning of the pandemic when, maybe it could have done a little more. I don't want to say good, but a little more.
Yeah. No, it's a fair question, Corey. We can't, of course, speak for the US CDC. It was their guidance document that got revised on Friday evening. But I think what we've learned so far about masking, particularly in light of a more contagious Omicron variant, just underscores how important it is to be masked, particularly if you're in an indoor public space. What the CDC's document did was also set forth some categories of individuals who may benefit from upgrading their mask even more, beyond just a surgical mask, up to what's called a respirator, folks who are immune compromised, things of that nature. And I think that was really what the CDC was getting at, to those categories of folks who would particularly benefit from that upgraded mask.
Absolutely. And that leads me into the second part of my question, which is, how much more effective are the N95, KN95 masks as compared to the surgical masks or the cloth masks that are widely available?
Yeah, it's a great question, Corey. It does vary a bit based on whether the person wearing the respirator, the N95, has gone through the fit testing process, things of that nature. Masks do 2 things. They protect other people from you, and they protect you from other people. That is to say, they prevent you from spreading COVID, they prevent you from getting COVID. What an N95 really shores up is it reduces even further your risk of getting COVID. N95s and surgical masks both do a great job at reducing your likelihood of spreading COVID. But if you're someone who, for example, is a healthcare worker or is immune compromised, you also want to shore up your protection from getting COVID. And that's really what those N95 type respirators really do really, really well.
Thank you.
Thanks, Corey. And the last question for the afternoon goes to Sean Murphy from Spectrum.
Hi, Dr. Shah, Commissioner Lambrou. Thanks for your time. I think you've answered most of the questions I had. I just want to go back very quickly, and just verify some of the numbers you said earlier, because they seem to be pretty large. Even though you're only seeing 1,545 new cases today, that doesn't really tell the whole story. You said that on average, you tend to have 3,172 positive tests daily right about now. And then, in fact, you have a backlog of about 46,000 lab results still waiting review. If I get all that right?
That is correct, Sean.
Okay, just wanted to make sure I had that correct. So that's the reason you're saying that not to trust the daily case numbers per se.
No, it's not to trust them. It's just that they don't tell you. They don't mean what I think folks think they mean. They are accurate. They are trustworthy. But the answer to the question is, where is the pandemic going? Is not the daily case number.
Okay, thank you very much.
Yep, thanks, Sean. And thanks to everyone for bearing with us today. We had a lot of questions, and again, I went on at more length than usual. But thank you all for your time today. Very much appreciate it. I look forward to seeing everyone again next week. In the meantime, be kind and take care of one another. We'll see everyone soon.